Every year, thousands of car drivers die in auto accidents for various reasons. The number of deaths often far exceeds the casualties in a war. But the sense of tragedy from war casualties is more deeply felt than auto deaths. This asymmetric response is due to the fact that auto deaths are seemingly random and decentralized, but war casualties are a result of a deliberate, centralized choice to wage war. Similarly, when medical treatments are denied by health insurers with centralized decision power, the sense of tragedy and outrage is palpable. Yet every day, many uninsured people die from all kinds of illnesses for lack of health insurance without much media attention. How can we have health coverage for all and still avoid the sense of tragedy when some medically feasible but cost-ineffective treatments are denied?
Insurers, bloodsuckers! Bloodsuckers, insurers!
If you are currently insured by an employer-sponsored health plan, your health insurers collect the premiums and decide for you how your health dollars are spent. In other words, the health insurers centralize both the pooling and allocation of your health dollars. Because fund allocation is centralized, the health insurer's decision has to pass 4 criteria. First, is the treatment medically feasible? Second, is the treatment cost-effective? Third, is the procedure legal? Fourth, is it politically correct? Suppose there is a treatment that costs up to $5,000 to extend quality-adjusted life for 1 year. If the treatment passes the first 3 criteria, it will be funded. Political correctness becomes moot. But if a treatment passes the first 2 criteria, but it is not legal, it will not be funded. But the issue of political correctness will be hotly debated. Think abortion.
Pro-life! Pro-choice! Pro-life! Pro-choice!
Suppose there is a treatment that costs up to $1 million to extend quality-adjusted life for 1 year. This treatment is medically feasible, but cost-ineffective. Though legal, funding should be denied. But the decision may be overturned because it is too politically incorrect.
Save Grandma! Save Grandma!
The inability of denying cost-ineffective treatments, charging the same premiums regardless of health conditions, and the encouragement of risky lifestyles have resulted in soaring health costs for everybody and make health insurance unaffordable for 24% of the population. The same national health budget could cover everybody with much more effective cost control if the health dollars are decentralized equally to individual health consumers. 1/3 of the health dollars in each individual account is reserved for minor illnesses and preventive care. Health providers must offer competitive prices to earn their dollars in the marketplace. 2/3 of the health dollars are reserved for risk pooling in major illnesses. Risk pooling is coordinated by health unions. Health unions raise funds from their members based on their expressed treatment preferences captured in a centralized database. Members can vote yes, no, ask me, or convince me for each treatment or categories of treatments. On receiving a funding request, the health union checks the members' treatment preferences database. If all or most of the members approve the treatment, funds will be withdrawn from the member's account. If not, funding will be denied. When preferences are divergent, the health union must send funding appeals to members who want to be asked. If enough Ask Me members vote yes, the treatment will be approved. Otherwise, the treatment will be denied. For new treatments, many members need to be educated, and their preferences will be updated in the preference database. Because treatment preferences are decentralized, they don't have to be politically correct. And because individual preferences can vary from case to case, they are not bound by funding precedents. And because health unions simply execute their members' funding preferences, they cannot be sued. So the sense of tragedy of centralized choices can be more easily avoided. Because the individual health dollar budget is tied to the global cap of health expenditures out of GDP, the soaring cost of health care can be stabilized. The absolute amount of health dollars will continue to grow, but no faster than the growth of GDP.